All right, good day, folks, from wherever you are listening in. Welcome to the show. Good morning, Sri Lanka, and good day to people who are listening out there from Australia. It's good to be back on the show, and after a short pause, it's always good to be back. And welcome to all the viewers. It's nice to have you with us this morning. And big hi to my two very special guests, the super duo from Australia. They've been on the show sometime back, and they are back again due to popular demand. And so today we are going to talk about something that it's really interesting, and lots of people wrote to me earlier to try and address this issue that it's a common problem faced by lots of people, and including myself. And I'm living proof, that one human struggling with a back pain, for a chronic back pain, I would call it, for a while. And thanks to these two gentlemen, through their guidance, and I'm surely but slowly trying to overcome all the issues. And back issues, or back pain or back problem, is ongoing problem for lots of people out there. So today's show is all about these two professionals, the ultimate professionals, going to address all issues relating to back pain. And hopefully that you can join in and learn everything that we don't know about back pain, and how to manage the treatment. What are the causes behind it. Everything else, hopefully, these two gentlemen will cover up. And without further ado, let me bring in the two gentlemen on standby. So on screen shortly will be Dulan, followed by Kusal. Just hope all can see these two lovely young lads from down under. Good day, boys. How's it going? Hope everything good.
Hi, Charit. How are you?
Good to have you back. Good to have you back. Nice to see you guys, and it's brilliant to have you. And welcome back. And yeah, so we had a chat offline sometime back. Want to discuss about this. The problem that, as I mentioned earlier, that a problem that lots of people are faced at this moment. So as I said earlier, shall we start with Dulan and say what Dulan has to say about the whole issue? The show is called Back Pain. Over to you, Dulan.
Yeah, thanks, Charit. And it's my privilege to talk to everyone once again together with Kusal. I have a lot of respect for him and for the work he does and what he brings to the table as a highly qualified and experienced physio. And it's a quite interesting topic that you've chosen today, the back pain, because we all know that most of us experience some kind of a back pain in our lifetime. So it is quite important that I think we have a kind of a good understanding of what back pains are and how it can happen. So my primary task today is, we have had a brief chat between myself and Kusal. So I would be talking a bit about the structures which can be involved and putting out a bit of facts in front of everybody, and how back pain can impact on sports, and basically what kind of factors can cause different types of common back pains, and then hand over to Kusal to talk about more focused on what kind of different approaches we take in terms of treatment. And then I think mostly throughout this session, we will be feeding off each other for our experience. So I think I will have some stuff to share about my experience working not only here in Australia, but back home in Sri Lanka as well. So
Brilliant,
yeah,
mate.
let's get started. Right.
Yeah.
You to move on to the next one, Charit. That's okay.
Okay. And a big hi to Azmin Hanifa, watching all the way from Kandy. He says, it's a cold morning, misty, 23 degrees. It's it's pretty cool out there, and I would say I wouldn't call it cold. What's the weather like in Aussie right now, mate?
I think outside it's about 12, maybe 12, 13 degrees. So it's cloudy today
But it feels a
and
lot more
quite
cooler than
cold.
that.
during the day it's very cold, so mornings are even colder.
Okay. All right. I think this is what you wanted. Dulan, have I got the correct slide on?
I'm just wondering whether Charit went
Yeah,
offline there. You
yeah.
can,
I can see the slide and you, Kusal.
yeah,
On,
yeah. He
on,
also lost Charit at the moment. Maybe we can just continue, and when Charit comes back, hopefully
yeah.
everyone is still
Am I back
able
on?
to get the information.
Sure. No, he's back. I think.
Am I
Okay.
back?
Awesome. Okay, cool. So, in order to talk about back pains, I think it is important to know what kind of structures which can be involved. As most of you would know that in any part of our body, most of our body structures are made out of joints, nerves, muscles, tendons, and ligaments. And if you think about the back itself, back is made up of spinal joints and discs in between the joints, nerves, again, muscles, tendons, and ligaments. And a problem in any of these structures may lead to cause some kind of a back pain in our lifespan. So to move on to the next one,
Right.
Charit, can you, if you can move to the next slide, please?
Okay.
Can't see
Just a
Charit.
minute, mate. Let me get your.
I wonder whether he can see us or
Yeah,
I
hear
can
us.
see you guys. Yes, yes. I can hear you guys very
I can
well.
still hear and see you, Kusal.
Can you hear me?
Mm,
I've just sent Charit a message as well, just to say.
yeah.
Can you hear
Okay.
me now?
Moving on to talk about bit on the facts about back pain. So I put up some statistics from Australia. You guys might be wondering, we are mainly targeting the Sri Lankan population, but why am I presenting Australian stats? But there is a reason behind that. That the Australian population is kind of similar to Sri Lankan population. The Australian population at the moment is about 25 million, whereas Sri Lankan population is about 22 million. Quite similar, uh, even though the geographical landmarks are a bit different compared to the two countries. So, if I have to present some of the facts from Australia, at any given time, about 25% of Australians will experience low back pain, and it is also found out that low back pain is the most common factor which is leading to disability when the life years are adjusted globally. Also, low back pain is among the 10 most common presentations in general practice clinics here in Australia, along with most commonly found conditions, I think, in any country, which includes hypertension, diabetes, and osteoarthritis. So you all will agree now when you see back pain tagged together with these kind of conditions, we give a lot of priority to these kind of conditions, hypertension, diabetes, and osteoarthritis in our lives. But then back pain is equally important when you consider these other systemic diseases which you might have in your life. So let's move on to the next slide, Charit, if we can.
Okay. All right.
The other thing I'd like to add here, Dulan, is
Yeah,
in Australia, I mean, we about 80% of all the cases as a physiotherapist I've treated was something to do with low back problems. And
correct.
one of the clear reasons here is it's such a highly urbanized country, and what we're seeing even in Sri Lanka is things are moving very fast into being a highly fast developing urbanization. So some of the things we're talking about now can actually prevent the problems in Sri Lanka, whereas the Australians have gone through it and they've had all these issues. So some of these concepts we're talking about can definitely help prevent some of the problems that could arise in places like Sri Lanka.
Oh,
Yeah,
brilliant. So,
absolutely.
before Dulan
To
takes over,
reiterate on the point you made, actually, I put up in this slide as well, like up to about 80% of people will experience low back pain in their lifetime. And this quite kind of fits with our clinical practice as well. Because what we see, again, just like what you said, 8 out of 10 people will be presenting to us with some kind of a back pain. It does not have to be low back pain itself, but then just like Charit's friend pointed out in her post, that it could be neck pain, upper back pain, lower back pain, or mixture of all these things when we talk about back pains. And also some other facts I wanted to touch base is back pain is found to be one of the leading causes for missed work here in Australia. And also 65% of the people who would experience back pains will endure pain and disability within 12 months from the onset of first onset of their symptoms, which is quite serious as well. So do you want to add anything on these facts, Kusal, or we good to move?
That is quite okay, Dulan.
Yeah.
That's
all
really
right,
good.
boys.
That's
And
pretty comprehensive.
that's just a
Yeah.
snapshot of, in general, what can happen in terms of the landscape of back pain presentations here in Australia. I'm pretty sure it would be similar in Sri Lanka as well, but unfortunately, we don't have any scientific evidence behind in Sri Lanka to present these figures, which is very timely need, I would say. So, if someone could take the lead and then do a bit of research and come up with these kind of factors, I think it will be quite important, just like Kusal mentioned a short while ago, in order to actually develop injury risk minimization and prevention strategies and policies and procedures to be in place.
All right,
So
boys.
let's move
Before
on
you
to the next slide,
can you
Charit, if
guys
we
hear
can.
me? Can
I'm
you
just
guys hear
going
me?
to present a
Hello.
bit of
Can you guys hear me?
statistics on back pain in sports, so that you guys will have some kind of understanding how back pain is impacting in sports and how important it is in terms of not only just a couple of sports, but in many sports we come across it. Charit is trying to say something. I think I can hear him, but
Hang
not
on a
listen.
second. Can you guys hear me?
Oh, yes, now, just now.
Now we can hear you.
All
Now.
right,
Before
but
we couldn't hear
yeah,
you.
okay, all right. These things happen. In a live broadcast. Just before you move on to your next slide,
Yeah.
big hi going out to Lalit Gunaratna, following you from Arizona, USA. Thank you. Nice to have you on the show, Lalitaya. Oh my God, Bipin Dani. My question to Dulan and Charit. It's a little controversial. I think we spoke about it the last time you were on the show. Bipin is a leading journalist from India, and it's a tricky question, mate. It's not relating to back pain. It's something very personal, where you are concerned, Dulan. If you wish not to talk about it, you can avoid that. He just wants to know why can't the Sri Lanka Cricket Board uh, can't hire Dulan for national team, or at least when the team travels to Australia. Do you want to respond to that? And before you go on, Firoza Oskiri, I think I got the name right. Good to have you on the show, mate. He's all the way from Turkey watching, and Aruna Samarajiva watching from home. I too have a nagging issue in my low back pain with my knee. Great initiative, Tarik. Aruna, keep listening. The boys will talk about all the areas that that concerns back pain. And Jason, yeah, I think he's from he's Udit. Good to have you on the show as well. Yeah, carry on, Dulan. It's over to you now.
Okay, cool. If we can move to the next slide, then, and just to briefly answer Mr. Bipin's query, I think
Yeah.
he has written a couple of articles on the research I do and the work I do
All
as well.
right. Okay.
He knows a bit of background about the work I'm doing here with CA and all that. I think just to keep the answer short, this is not the right platform to talk about personal issues, I think. If there's a proper approach, and then if there's a request, I don't think I would hesitate to come and help my country and its most popular sport. But it has to come through the appropriate channel in an appropriate way, I think. To
Yep,
keep it short, yeah.
the way to
Just
go. Yep, well said,
let's
mate.
deal with this one, I think. And thank you for putting it up. But I think, yeah,
First things first. Yes, let's
of
get
course,
back to the topic. Yes.
yeah.
Yeah, mate. You want the next slide on?
Yes, please, yes.
I think let's. Where are we? We are on facts, and let's
Yeah, it's number 5.
Okay, it's on number 5. Let's get number 5. The slide back on. Back pain in sport. I think this will be very interesting for.
I can see a lot of sporty people, including Mr. Bipin and a couple of cricketers whom I know from Australia have joined us live. I think they must be keen to know what is happening in sports. Until you bring up the slide, Charit, I think I'll talk a bit about the impact
on,
of
mate.
back pain in
Yeah.
sports. Yeah, if you can see the slide which has come up, I put up like a lot of sports, and then you will see that the numbers are very high in some sports like gymnastics, weightlifting, and wrestling, including cricket. So we all know whoever is linked to cricket. I think Kusal would be the ideal person to talk about golf-related back pain. Being a good golfer, I've seen him going and playing golf. But my main area of interest and area of work being with cricketers, we see day in and out a lot of fast bowlers at young age going through lot of back issues. And if we think in broader terms for all these back issues related to sports, mainly it is something to do primarily in terms of their biomechanics, how their bodies are structured, and how they are used to move, different movement patterns, and how loading will take place in different structures of their body, and how forces are transmitted through different parts of their body. All these factors in combination, and plus the level of strength and conditioning will contribute to these issues in different sports. And then Kusal can add some on this one as well. Just to add a bit, some of these sports you may see like gymnastics, weightlifting, and wrestling. The impacts those sports will have on the bodies itself. I can talk a bit about cricket fast bowling. If someone's new to all this, if you don't know how much of a weight is transferred when a fast bowler lands and then delivers the ball, it is considered the amount of force transmitted through the low back is 6 times into the body weight. So just imagine, like, if somebody is 80 kilos, how much of a force is being transferred through the low back when they land to deliver a ball. It's found out it's 6 times into body weight, which is quite a lot of force. So if it's someone 80, so it's like nearly 500 kilos of force transmitted through the lower part of their spine. So you may realize that how strong they have to be in terms of trying and minimizing and possibly preventing these kind of injuries in sports. So this is just putting out a little bit of facts. Kusal, if you would like to add a bit on
Yeah,
this.
mate. That's very useful. Jason, listening out there, he says Sri Lanka lacks fast bowlers. He's a boy that who wants to bowl faster as possible. Sometime in future. If you're listening in, this is golden advice, mate. I hope you heard what Dulan said. Take it into account. When you're trying to bowl fast, look after your back. That's cricket is one sport that I think if I'm not mistaken, having looked at your stats, perhaps the most number of back issues, unfortunately, that with cricket, and out of that, higher percentage are fast bowlers. So it's primarily important that you listen to your coaches and how you preserve your physique and just to prolong your career. It's strange, guys. I mean, during my time, just to butt in, never heard of our fast bowlers. I don't know whether the guys ever, whether they had back problems or whether they never complained or that. And they used to do a lot of work. And I mean, those guys used to, for a day, they used to bowl for at least like 15 overs for a day and never complained about back pains. I don't know whether they were versatile sportsmen or because they most of them they played other than cricket they played rugby and whatever just they were born strong or just good genes or whatever. The amount of injuries that I see right now is unbelievable. With all
Hmm.
the technology, the top physios like you guys, the workloads managed, and
Sarit, something,
yeah, go
something
on, mate.
to add to that actually is what I have realized in terms of cricket is that if you see the last 10 years, especially with the introduction of T20 cricket and then T10 cricket, like shorter formats of these, I mean, new formats of the game,
Right.
and then plus a lot of global competitions coming up. If you would see, like in terms of the general workload,
Yeah.
some of these cricketers, like if you compare it to 20 years back, we have had a off-season, so-called off-season period.
Okay.
But most of these young cricketers who are playing cricket actively in the last 10 years, they do not go
Yeah.
through off-season period as such, because what we call a off-season for Sri Lanka might be their season like somewhere else playing cricket as well. So they never get a rest, a so-called rest, of what we call it as the off-season, which we used to actually concentrate to do all this strength and conditioning or whatever
All right.
things, rehab, and then rest, recuperate, and then get back to the game. It's
Right.
not about, like, I mean, the general. We have to think the global picture as well. It's not only about the training and then how much of bowling they would do in training and whether that is changed or the. And having said that, with the introduction of T20 and all this short format of games, the speed of the game has changed quite significantly as well. If you would think 20 years back to now, and the demands, physical demands, along with the nature of the game has increased naturally. So
Well explained, mate. Yeah.
these
Yeah.
are the reasons I feel that which is putting additional pressure onto lot of these cricketers, and especially we see day in and out, not only in Sri Lanka but in other countries as well, including Australia, that a lot of fast bowlers break down because, and that is why this concept comes out every now and then in the media as well. Countries like Australia, England, they talk about the rotation policy and then workload management of these fast bowlers, because they need to make sure that everybody is kept like well and good. I mean, fine tuned to be playing cricket for the next 5 to 10 years. So that's why they talk about all these rotation policies and then plus workload management.
All right.
Uh,
Hmm.
I
I
think that
think
is that
also,
is the secret
Charit,
behind getting some rest. I think.
Charit, I think something you brought up really, a really good point. In the 70s, 80s, the probably the statistics weren't out then, but at the same time, the idea of people having back problems and things like this were not as evident. But there is some truth to that, because back in the day, people used to train very cricket specific skills, which is, when it comes to bowling, there was a lot more bowling done, there
Yeah.
was a lot more batting done. And even right now in Australia, we're changing our screening techniques. And I'll just talk about cricket, is to make it very specific to something to do with that sport. And when you can have the screening that is very relevant to the sport, then you're going to pretty much find out if there's any other problems that could then cause problems like back problems. But um, you know, also another thing is there's a lot more athletes thinking, and some of the younger ones, inexperienced ones, thinking, look, I need to get stronger, I need to go into the gym, I need to bulk up, that'll be my protective layer over all the sport that I play. That's certainly not true, and we'll definitely touch upon that, because what we know now is in sports medicine, it has to be very specific to the sport, it has to be very specific to your own body, So everything has to be customized, which will then prevent things like back problems, and also then we'll definitely see the numbers go down in injuries. And
All right, guys.
you know,
Very well explained. And there's a guy, it's a very special guy, Mervin Fernando, who has just joined us. And actually, this, he's one of the, I would say that, this is his idea that, wanted me to, one of the guys who wanted to have this show. Mervin is one guy, is struggling with a nagging back pain. He's, back in the day, the guy was a top athlete, and, that he has done many number of sports, and he's been a good wrestler. At the moment, the guy is really suffering with a back problem, and he's just curtailing and hampering his lifestyle. And the poor guy. So whatever that that he's gone through a lot. So the boys, if we can be, Mervin can be specific, where the problem is, so that you boys can help him out. And hang on, that Ratnavir Navina says, hold on, it's a long email. Chaitanya discussion we should have had many years ago. Thanks for taking it up, especially at school that take part in competitive sports to have regular service of a medical consultant. Their presence at matches together with first aid ambulance. Yeah, and yeah, very good point. And unfortunately, Navi, that even at club level, that that the time we played, we have never heard of you guys. The physios came into sport quite recently. Now only we realize what we lacked during those days. And at school level, I'm very sad to say, it's very unlikely that most of the schools have services of a physio. It's a very good point. And if they can employ or have one of these guys, there are quite a few very, I would say, what can I say, the good physios around in Sri Lanka, and there are quite a few of them who are properly trained. Most of the guys attached to services, etc., etc., and you can hire their services. I think it's a very good point, and someone should take it up and must emphasize that all. I think rugby, for must give credit to rugby. They have services of a physio even at school level. But in cricket, unfortunately, it's not happening. And hopefully in the future, that I would like to see it. So it's a very good point. Thanks, Navi. It's good to have you on the show, mate. Dulan, I think you are still on back pain and
yeah. So just a little thing I want to add on to what Kusal said just a while ago. In terms of the importance of screening, I think not only in cricket but in any sport, I've been trying to stress this out so many times. I think I've tried to let SLC know the importance of this. Especially when we consider the screening, we only consider the elite level of cohort only. But I think just like how Kusal rightly pointed out, it is very important we consider the age groups as well. What we do pretty good in Australia with not only cricket but with all the sports is that we are actually screening the age group talent ID as well. So in terms of having these kind of issues from a younger age, we kind of identify then and there if there's an issue. We do not leave it till late when they probably when they are 18 to 20, when it's a bit too late to do something and then help them. So because we try and screen them as young as we could and then identify these problems pretty early in their career, so we can actually very efficiently and effectively help these sports people, not only with back injuries, with other injuries as well. So it is quite vital to have the screening and as well as to do it in age group levels as well, to have a early, identification and plan interventions accordingly. So that's a very vital thing which I've suggested to SLC.
Right.
I just don't know where the thing has gone, but I've suggested them this like a while ago, about 3 years back.
All right, mate. Just sorry to disrupt you. I can see Deepa is online. I think Deepa has a few questions for you guys, if I'm not mistaken. Let me see whether I could bring in Deepa just to help her out. She has a few questions. I hope you guys don't mind interacting with Deepa and say hi to her. Deepa, if you're around, let me try and get Deepa online. Let's see. Yes, she is.
Hi,
Yeah.
Dulan.
Hi. How are you? How are you doing, Deepa?
I'm good, thank you. Hi, Dulan. Hi, Kusal.
Hello. Good to see you, Deepa.
hi Deepa, how are you?
I'm good, thank you. Moved to a new place. It's very blue.
All
Um,
right. Okay.
so I just wanted to share something because I just saw the recent slide that sleep dis is happening with women. And my experience was that for a long time, I went to school and we were sitting down most of the time. And I noticed that I had some tightness even as a young girl. So I think it had to do with my physiology. The fact that a lot of times teachers are now emphasizing on studying and less on sports. And also a lot of the techniques taught in school was not accurate, not up to science, and the stretches were wrong. So kids were actually playing and doing the wrong things even at such a young age. But come to my late 20s, early 30s, I was in a very stressful work situation, went to China in this really like bumpy road. And the next morning I couldn't get up because of my slip disc. And I found out that it was, I think, between L5 and I think just
S1.
the lowest disc.
S1. Yeah.
Yeah, L1 and L5, I think. Yeah.
L5
So,
S1. Yeah.
S1. Yeah. So the thing is that when I first went for treatment, they just, there was a lot of release from the physiotherapist. And it's good, but I then kept going back for treatment over and over and again. And they also talked about stop weightlifting. So then when I stopped weightlifting, I lost a lot of muscle structure. So in the 4 years, I started to develop upper body pain because I stopped carrying things altogether. So I not only had like a weaker physiology but I also had to rely so much on physiotherapy until I came across Pilates and strength-based training. And then they I actually went out and studied all about the spine, the posture, how to strengthen the core, how muscles work together, and how it's important to have stretches and strength-based training with movement, like the last session you guys talked about. So I really had to go on a whole journey to relearn the whole concept of treating the spine again. So yeah, so I just wanted to share with you guys where I was coming from and how we can educate women to take care of their back, but not just women, but also everybody. But our physiology is slightly different. Just
So
sharing.
Deepa, what you've gone through there, Deepa, is so common amongst a lot of the people that I see, even in Australia. The fact that I put all of this as a classification like a pyramid. So at the base of the pyramid, it's the body's biomechanics. Now your biomechanics are made up of your nerves. The nerves are composed and start off with your central nervous system, or I like to call it the CPU, the main brain of the, pretty much the brain, but the main computer system, then passing all the information onwards. So then the neural pathways, your muscles, your joints, your ligaments, and then everything else that makes everything up. So once you get that right, once you get the biomechanics right, then it's about flexibility. So once you get the flexibility, the body needs to get control within that. And then on top of that is your core, which is what you were doing with the Pilates. And then the final thing right at the top of the pyramid I classify as strengthening and conditioning. So when people get back problems, and it's actually any injury, as soon as they get an injury, the first thing they think about is, oh look, I've got pain, so I need to get stronger. So they start at the wrong end. They start at the top end of this pyramid. Then the next thing I know a lot of people say is, oh, I've heard about yoga, I've heard about Pilates, I've heard about building the core. Maybe that is the problem. Then they've still starting at the wrong end. They're at the top of the pyramid. What I tell a lot of people is we need to start at the bottom. We need to look at the nerves, look at the muscles, look at the joints, look at the ligaments, get the foundation right, then get the flexibility, then get the control within that flexibility. So unfortunately, even in Australia, that is not well known. But if you systemize it or you categorize everything that way, you'll end up getting the results you did. Only thing is, it took probably many years to get to that.
4 years.
4 years. Now, the other reason why you got that problem is from a young age, what we know about children is they're very active. You don't have many children running around saying, "Look, I've actually got a back problem." Back problems only arise after puberty, after our teenage years, and there's a very good reason for that. The spine, when we're younger, or children when they play sport, the spine moves in many different ranges. So it bends forwards, backwards, it turns left and right, and side to side. So with children's sport, and you can see children playing, the spine is actually moving in a lot of ways. But in adulthood, uh, what happens is we're always on computer, we're writing things down, we're just moving only ever in this forward and backward movement. All these rotations and the other lateral movements are missed. So if you imagine a joint, or in your body, if 2/3 of something is missing, and then you're still asking the body to be as active as you want it to be, then this CPU will say, no, 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 hang on, Deepa, something's wrong here. I don't really know what's going on. So the brain then tries to protect you, and the brain then says, the first place I need to give pain is the place she's going to damage the most, which is your lower back. And that's why even in Australia, and low back problems are very common right throughout the world, or spinal problems are very common right throughout the world. So that's the other reason why you potentially ended up with this. The third thing I just want to share is that the body is 70% fluid, and we're meant to be moving. We are only ever meant to be sitting for 45 minutes. After 45 minutes, I recommend people just standing up, going and getting a drink of water, going to the bathroom, just changing position. Because if you sit there, and we're 70% fluid encased in this soft thing called skin, and we're meant to be dynamic creatures. And it's so vital for any parents listening to this that they see how their children are in front of the computer. If they're studying a lot, we're
Yes.
only meant to be in one position for 45 minutes. After that, you really have to move. Otherwise, it is bad for you.
Yeah.
Well said, Kusal. I think it's very well explained, Deepa. I think that in a nutshell, what he said. When you have a back problem, I think it's primarily important that you get to the root cause. That no point attending to it. At the top of the pyramid, you start at the bottom. That's where I think we do things haphazardly, like what you guys did with my back. Just simple stretches, and get the flexibility going, and which has helped me a lot, by the way, Dulan and Kusal. I keep rolling my back, with foam rollers and those little balls, and all those things. I think it has helped me immensely. Yeah, one of those. And but it's still, there you go, girl. That's what we are talking about. And I think that is something that everybody should have: a foam roller and one of those little balls. And I don't know what you call it. That by the way, that the Mervin has sent, his problem. I think if you guys can help him out. First, the back pain on both sides around L4, 6. He says L5, yeah, 4 and 5.
L5.
Yeah, and now pain coming down the right leg up to the toes, and also a burning sensation. Doctors have me most of the times on painkillers and some GABA, Pantene, and stretchers for performing muscle. Now the pain is also around hip bone, joining the legs. Lots of MRIs and X-rays, and just wondering how safe was doing these ultrasounds and dry needling. Guy is gone through the whole rigmarole, mate. Anything that you guys can add on to that?
So I think
Just a little thing before I think I will let Kusal speak. Do you know like how long he's been having this issue for though? Because I think it's vital to know. It looks like he's gone through so many things and so
Yes.
many different kinds of treatment and investigation and all that. Like, but because it is important to know if it's a chronic problem. I think
It is a chronic problem. Yeah, the
yeah,
guy is in his
it is
60s.
a chronic problem.
Yes, it's a chronic problem. Yes.
Okay, because it is like it can go beyond the scope of just treating the symptoms because we might have to talk a bit about central sensitization and then things like that, Kusal. I think, yeah, that's the whole purpose I wanted to
And I
ask.
think the other thing to touch upon here is there are a lot of people like Mervin who have these problems for so long, and unfortunately, the therapy that they've had is only treating the symptoms. And like you said, Charit, you're only ever going to get so much response when you treat the symptoms. I'm a big believer in going right to find the root cause of the problem. So, Deepa, I was explaining to you about the performance pyramid, which is the five things. Add to that a 24-hour cycle, which is something I'd like to evaluate for Mervyn, and then work out in a 24-hour cycle, you're going to get 8 hours of sleep, 8 hours of activity, and then 8 hours of work potentially.
Right.
And within the 24-hour cycle, now in sleep, I really like to know whether a person's mattress is less than 8 to 10 years old, because I could be the best therapist in the world, but if the mattress is 15, 20 years old, they can undo a lot of the good work. The other component is in the 8 hours of work that we're now seeing in Australia. A lot of people are working from home. The postures aren't great. They're hunched over. Companies here spent millions of dollars trying to get the right chair, right desk. All of a sudden, within a matter of weeks, people were working from home, in their children's bedrooms and children's little desks. And in Australia, it's going to be a big thing. It's a big problem that we'll face as physiotherapists and in ergonomics as well. So then, for someone like Mervyn, I'd want to then find out what he's doing in everyday life. And then, there's another component, which is the nutrition. And we're going to talk about all of this.
Yeah.
Unfortunately, when a person has struggled with pain for that long, there is a mental drain on it all. So stress plays a big part. I'm more than happy to speak to Mervyn offline and discuss some of these things. The other good news with back problems, us as physiotherapists and in a multidisciplinary approach, when we talk about dietetics, we talk about sports psychology or psychology and the mental health side.
Yeah.
There's only ever a list of things that can go wrong. If you start getting that list and ticking everything off as you go, little by little, you are going to get better. And then the approach is that you're going to uh, fix the root cause of the problem and not just the symptoms. Because, it's very simple to treat the symptoms. And Deepa, you may have had this as well with the back problem. Mervyn would be the same. When the back is the treatment, sometimes the needling is only ever on the back, or the soft tissue work is only ever on the back. Uh, the whole body's connected in a chain. The whole body's connected biomechanically, and I've actually treated people where the back problem was coming from the neck. I've had another one where a gentleman who had something like 20 years of back pain, and no one had ever looked at his feet. So he had this flat-footedness. And I was a young physio then, and I said, "Oh, look, let me just give this a go." I taped up the feet, and within 4 weeks, he said, "Oh, my God, Kusal, the improvement I've had, because all of a sudden the alignment and the biomechanics have changed." So always treat the root cause.
So,
Can I add a little bit on to this one, Kusal? I think I absolutely agree with what you were saying. This is something I do in my clinic as well. Something very simple I do with some of my patients is that if they have like a long term ongoing neck pain, what I try to do is the second visit I try to get them to bring the pillow, or one pillow or two pillows they use to sleep. I will check the neck position in like supine lying, side lying, various different positions, and see whether the pillow is contributing. Sometimes if I find the pillow is a contributing factor, I'll get them to change the pillow. And if I think that it's something to do with the work environment, a little thing what I ask is, like, these days everybody has a smartphone. I will get them to do a short video from back and from the sideways, a full video, so that I get to see what they're doing at their workstation, and I will give advice accordingly to modify those postures. So that in turn will help. And for some of my patients, I've asked them to change to a better ergonomic chair. And for some people, I've advised them to lower the height of the screen of the computer, or else I've asked them to adjust the height of the chair, just like how Kusal said. And it is quite important we just go beyond the scope of just treating the symptoms. Otherwise, you're not going to find a permanent solution to the problem, because you are just trying to put a plaster, just like a band-aid to the problem. If you're just treating the symptoms, it is not going to go away in the long term. So absolutely agree with what Kusal has said. You have to see the global picture.
Yeah.
Well said, guys. That Mervin, he says, thank you very much, sir. That as Kusal said, that if you want to contact any of these guys, they are very much happy to help anyone out there. With they are. That's why they are here. They are doing a lot of service to the humanity. Anyone struggling, they're happy to help people out. It's good to have you. And Bipin, your question was answered by Kusal. Sorry about your connection. I mean, this is what happens during a live broadcast. Things can go wrong. That earlier mine went wrong to see that yours have gone wrong. But basically, what Dulan said, this is a problem that SLC should to
No,
address.
I think Charit, I think he's asking a different question. Like, if someone has a back problem which is not resolved for over 4 months, what can you do?
Okay.
But basically, to answer the question, I think you need to see what the underlying condition and what is going on, especially if it's a past defect, and it can take a lot of time, more than 6 months, for the player to come back. And then, especially with cricket and elite cricketers, just like how mentioned just a while ago, we would tend not to rush them back into active sports. I mean, competitive cricket, because just like how I mentioned 30 minutes ago, you would have realized like how much of a demand and a loading which takes place on the body. So we need to condition them properly, and that will take time. It is not doesn't mean that 6 months they will be taking rest. We will be doing a lot of background work. Initially, we will be doing a lot of hands-on work, and then slowly transitioning into strength and conditioning work. In the background, we'll be doing a lot of rehab work in the pools with them. I mean, this involves a lot of work, one-on-one work, and then a lot of other things, including the multidisciplinary team, just like how Kusal has mentioned. So this is what is happening in the background for so many months. Not that we will keep him quiet for 6 months and then he comes back, and then that rest, so-called rest for 6 months, has helped him to come back. That is not the case. So there will be a lot of activities going in the background, which people will not get to see in the media or in front of a screen. But then there is big effort needs to be put in the background. But 4 months or 6 months, that time period will be actually decided again based on the progress of the recovery. And plus we will be again doing certain screening tests, just like how Kusal said. So we would absolutely want to make sure that particular player is fit and ticks all the boxes before he goes back, because we don't want to risk him getting another injury by putting him back before the time period which we think is suitable for him to return to play. So it has to do something to do with ticking all the boxes before we make him go back to competitive cricket or whatever sport they have to go back.
Right, brilliant, guys. Just before I let Deepa go, I'm saying that having Deepa on the show, I thought that is another question that I want uh, to bring up. This is like this prior to the show that Sumali from Kenya. She's a yoga instructress. Based in Kenya. She had done a lot of work, and she explained back problems comprehensively. That she sent a long mail saying what causes back problems, and she broke it down into many segments. How it can happen, and she had a very interesting view about, say, call it in a certain, you may call it a chronic back pain. And it's a holistic approach that she had. She said, can my question to you guys, and because I know Deepa will be very interested, deep rooted mental issues, can it cause back problems? And if it's nothing to do with the physical aspect of it, if it is mental, deeply rooted in your, I don't know, in yoga they talk of chakras and all those things. If it is something like that, how would you guys address a scenario like that?
So I guess that's. I mean, that was a big area. I saw that comment when it came up, Charit. It's a growing area in terms of what is required. to understand how the human body works. We finally know there's a big connect between the physical world and the mental world. That alone came out just because of COVID-19. Everyone, stress levels are high, but also physical injuries and physical ailments are high. Um, the comment that came up on Facebook was there's also a connect between it's almost the mind, the body, and the soul, and how that all connects as well. I'm a big believer in there is a connect. It's just that we haven't had the research or we haven't had the tools to measure it yet. So, something that's very typical of Western health is that they say, look, if it hasn't been researched, then it
Yeah.
can't be evidence based medicine. Um, my belief is we haven't really got the tools yet to measure what's going on in terms of the research. So we can't negate it. And it's very important not to negate it. Also, what we know about Ayurvedic treatments, what we know about Eastern philosophies, the true nature of human health and wellness will come out in the future when we understand physical, mental, and also the human psyche or the psyche, and pretty much mind, body, and soul. And it's always going to go together. So I'm a big believer in it. And, I have to say, if things are working for you as a practitioner out there where you're utilizing concepts of looking at, I think the example was different areas of back pain caused by different stress situations in life.
Yep.
I personally haven't had that any experience in it, but I certainly wouldn't negate it, and I applaud getting more information and then providing or getting more research done on the topic.
Well said, Kusal. The
Yeah,
Dulan, you have anything to say?
just a little thing, Charit, just to add on to what Kusal said.
Yeah.
So basically, just like how Kusal said, we go by research evidence most of the time, but then certain things like which research has not proven, we go actually based on the clinical evidence, what we see day in and out from our practice, how patients will respond and how they will improve as well. So why research is quite important is again to touch base on what Mervyn has brought about. He said like he has had like a lot of TENS ultrasound and dry needling going on. So if you think 30 years back in physiotherapy, like most of the physios would have used all these electrotherapy modalities, but there is no evidence behind it that they are actually helping to improve any of these problems. So that especially in Australia, we are kind of going away from these modalities which are proving very ineffective. So but that has taken about 10-20 years for us to like come to that situation. And just like Kusal mentioned a while ago, it is only a very selective number of practitioners who are doing this kind of evidence based practice, and some of them are still stuck with these old school thought of practices and just trying to treat the symptoms. So which is very unfortunate. I think especially in countries like Sri Lanka, the need is like to be updated with the current knowledge and evidence-based practice, and to actually change from the historical practices which we have been accustomed to doing. So that is a timely need, I would think so.
All right, Deepa, what do you think? You're into all these natural healing and natural food and all that stuff. As Kusal said, mind, body, and soul. What's the connection? What do you think of that?
So I think there's definitely a connection. There's something going on here, and we are seeing a change. The first thing that goes through my mind is that when we look at stress, there's also inflammation, and I know the physiotherapists will definitely agree that once your body is flared up, everything is flared up. There's going to be the muscles are going to take some time to recover. There's going to be injuries. You're going to be more injury prone. So there's definitely some links to that. So there is a link. And secondly, I also see that I think the posture plays an effect on your psychology. If you already have a spine problem, or you have issues from the past, and then you're slouching like that, and when people look at you, they're going to think, oh, this guy is not approachable or he's unhappy, and they're going to treat you the same way. But if you come to a room with an open body posture, with a strong good structure and those kind of things, people are going to treat you differently. They're going to say, hey, this guy is energetic, and in return there's going to be this energy exchange, but also your interactions in life is going to change as well, just based on your posture alone. And the third thing I wanted to say is that a lot of times I was also treated very specifically for one area, where I had the back pain. So they straight away went into the back, they put like ice and all that, but they didn't really check in the beginning how was my hips location. Did I have a flat foot, which I do. And when I was dancing, I had like leg problems and those kind of things. So in Ayurvedic treatment, I think back in those days, they actually used to look at a holistic approach. They used to give like a lot of oil massages. They used to realign your entire neck, hands, all the limbs and all those things so that you move as one unit, one holistic unit. So I think there's definitely a link there, Charit. And we definitely need to explore something in the future.
Yeah, now that you spoke about realigning, boys, and Deepa, I want to ask you, the time I was overseas, and that it is a common practice among the Indian community over there, and I think the term that they used was called pichoti. That's the term that they used. Probably Deepa knows about it. And if you have any issues in your body, you go to this. They are like holistic. They are like what do you call? They are like priests, and they do a bit of manipulation in your body, and they put the aligning back. Is that possible, boys? It's physically. Can you do that? Can you lose your alignment?
So what happens, Charith, is every joint in our body has a certain level of gas. I mean, the typical sense where you crack your knuckles is a typical example of that. And what most treatments, when it comes to the physical manipulations, you're either going to manipulate a joint or manipulate a muscle or something in between, or the fascia, which is the network of tissue throughout our body. So you either need to have a soft technique or a firm technique or something in between for each of these things. And there are different experts from around the world that can say, oh, hang on a second, one part of your neck's not right, or, something's not right in your shoulder. We need to make that adjustment. So, no, it's completely fine. Once again, as long as it's safe, and
Yeah.
it's, you're careful and, it's ethical, then these kinds of practices have been there for possibly even thousands of years.
Yeah.
Yeah.
And some of
Deepa,
these
yeah.
people have been treated family member to family member, and they brought it down generations, from the traditional aspect.
Yeah, Deepa, have you heard about it? Is it practiced in Malaysia? It's very common within the Indian community. It's popular. I think it was called pichoti. I think it probably it's south, not south, North Indian term. And anyways, good morning. Yeah, Romani, good morning to you as well. Leslie, back in my younger days, playing a lot of competitive badminton, I had constant back pain. My doctor explained to me the evolution of man walking on two legs from a four-legged animal. He suggested I sleep on the floor, flat surface. It worked for me. But is there any science to it? I was about to ask you that question, Kusal. Is sleeping on the ground or on a hard surface, is that okay? Is that going to help anyone with a back problem? That let's see, now we had brought the question up.
So usually the research has shown that it's a bad bed is not going to cause back problems. But in my experience, what I've found is if you've got a bad back and a bad
Yeah.
bed, then the recovery is a lot slower.
Okay.
So the way to then negate that, or the way to then prevent that, is to find a firm surface. Usually sleeping on the ground. Even in Australia, when we recommend people to go and buy a new mattress, we'd say first, get yourself the carpeted floor, add a few blankets, then sleep on top of that for a night or two. If you're waking up feeling a lot more comfortable, then it is the mattress. And I guess that's the experience from your viewer, that they slept on something firm, which was then providing that support over the 6 to 8 hours that they were sleeping. And we're finding posture is a very important thing. I think, Deepa, you were just mentioning that. We know now that when we are in pain, we have these closed off postures. And closed off postures increases our stress hormone cortisol. And it only takes 2 minutes to flush it out by growing. And if you can open up your posture, which is open shoulders, chest out, you only have to do it for 2 minutes. Cortisol levels drop.
Yeah.
And when, unfortunately, when we have cortisol levels, focus, concentration, uh, clear thinking go out the window. That's why when you have a back problem or any kind of chronic pain or any pain, we're in this position, we can't think clearly. And then to flush it out, we know now that posture plays a big part.
Yeah. And also, they talk about Charit, they talk about like chakras, like having an open heart. What they were talking about is really when we have an open heart, then we can give more. So that correlates with the concept of the heart chakra, right? You are more compassionate, you are in a happier mood, you are more willing to give to others because you kind of are not so stressed out. So I think that definitely correlates with that. And looking at the treatment for Ayurveda and those kind of things, I think one of the main key that they looked at is the practitioner's psychology. So they say that 50% of the healing is actually because of the doctor itself, the psychology of the doctor.
Yeah.
So when you go there, people maybe actually have a lot of other problems, and that's why they also have these symptoms. So when they are in a good, with a good doctor, presence of a healer, then they also improve psychologically and physiologically as well. So I think that's the
Yeah,
concept.
I totally agree
Um,
with that,
Yeah.
Deepa. I totally
yeah,
agree. I agree on two things there. One is when you get the alignment right, say only from a physical aspect, as a physio, getting the biomechanics, the flexibility, the mobility, the control, the core, when you get the alignment right, one of the things that does happen is the amount of energy that the people have. So creating you're creating an open reservoir within your body to function properly. The other thing is so true on what you said about the practitioner. When I teach, I talk about the 3 C's as becoming a good therapist. The first C is clinical skills. You need to have a certain level of skill. The second C is clinical reasoning, which is the problem solving methodology that you're going to use. What am I using to help Deepa go from this problem or to preventing it or to fixing it? And the third C is communication. And communication is the heart and the soul of the therapist. And if I am the best therapist in the world, and I have good clinical skills, clinical reasoning, but if my bed manner is bad, if my bed manner sucks, you will never come back to me. You will never recommend anyone else to me. And the number of times we have probably experienced this with doctors or other therapists
yes.
where the bedside manner is so poor.
Yeah.
And the healing actually comes from here, from the practitioners. So yes, I agree on that too.
Oh, brilliant. Mervin is still there, guys. If I can, I'm gonna.
Sharit, before we move on, just a little thing to add on to
Yeah.
what Kusal has mentioned. In terms of reasoning, a lot of the times I've found out a lot of practitioners, if the patient has a question to be asked, and especially if we do some kind of a treatment technique, they don't have a reasoning behind it, why they use it, and for what reason, and what kind of a benefit it will give to the patient. So the thing is, for me, I think if I'm able to explain why a particular kind of a treatment technique is used or why a particular kind of advice is given to the patient and the reasoning behind it, and so if the patient asks the question, especially, they will have a better understanding of why we are doing for what reason as well. So that will again increase the confidence in the patient about the not only about the treatment but on the therapist's ability to get them cured as well. So that is why it is very important. You can't be just doing it for the sake of doing, and someone else has done it for the same reason. So you need to have a proper reasoning of what it will do, how it will, if it will impact on any structures, how it can change and what it can change and what kind of an impact it can have. So you have to be specifically, um, giving an answer if a patient has a question to be answered for. And if you
Right.
don't know, then you can look back on somebody else and then get help from someone else whom you can think of. But most of us, I think, we are, I think, used to give answers just because we traditionally practice doing certain things, and that's why we use it. That's not a fair enough answer, I would say.
Right, right, got it. Mate, Mervin is still, looking for answers. One very clear symptom I have noticed is my legs are losing muscle mass and a kind of fatigue and a slight discomfort in the leg muscles from the hamstring area, making the legs weak. I became a diabetic in 2017 and started on medicine. And I think he's got so many complications going. He has lost his muscle mass, and I think, guys, it's very important that one of the things that can happen when you have a back problem, the that leads to so many other complications. That one thing is losing your muscle mass. That so how do you tell us about how is it now? For an example, if I may ask you now, if there's a guy in my squad, a young fast bowler, is with a kind of like a groin injury, which has become pretty chronic at the moment. How would you treat a guy? Would you take him off competitive sports full time, or you do your treatment and let the guy play? In order to stop the muscle mass, how do you guys go about?
I'm not a big fan of taking people right away, Charit, unless there is a real issue of danger to them. Soon as you bring a person, so back in the day, I'll give you an example. Back in the day, in the 70s, 80s, I think even in Australia, soon as someone had a back problem or any kind of injury, they would be prescribing bed rest.
Yeah.
And a bed, you've gone from being active to complete bed rest. And what we know now is not just the physical decrease, but also a mental effect on that as well. I have always used I guess the terminology that I've used is, any movement is going to be an improvement, but within tolerable levels of pain. Now, any movement that your young athlete has, then I'd like to see whether they're still functioning everything, one within tolerable pain levels, and I hope there aren't any pain levels when they are still functioning, but also their perceived exertion of any of their tasks. So when you can match pain with perceived exertion, then the athlete is functioning at the proper form. And a proper form is, how well an athlete moves in any of the functions or the tests that they're conducting. If it's someone, say it's a batsman, it's how well they run between the wickets, their running form, the running gait, fielding, for example. Whereas if they're running and they've got a bit of a limp, it's not, that is not good enough. You just have to still get them functioning somehow, but bring the activity levels to match, and therefore you're building, then the form is the same and you're building up form gradually, gradually, gradually. And therefore that person is not mentally, or the mental side of things isn't affected, and physically they're not starting from down here, they're starting from about 40 to 50% of what they were.
Right. Would you
That
recommend
really
the?
happened to me.
Sorry, yeah. Go
Sorry,
ahead.
Jan. That really happened to me because when I had a back injury and I used to do some weights before, like kettlebells and those kind of things. So it actually conditioned the rest of my body. So when the back injury happened, the previous therapist said stop carrying any weights. And in 1-2 years, I started to become lumpy and I had more problems because of that. And then I realized that actually because it's no exercise, and that's not the right advice to give, unfortunately. And that's why I decided to become a Pilates instructor, because I don't want this to happen to anybody else. So I think what Dulan was talking about, like starting from the system where we should look at stretching, a bit of movements, because if you stop the activity that you love the most, whatever sport that you're playing, it's going to affect you psychologically as well. So completely missing out on the physical activities is also not right. But doing it correctly, gradually, and I think that's where you guys are coming from.
Mm.
Yeah,
And
brilliant. Would you
the other
guys,
thing,
Kusal?
I would add for Mervyn,
Yeah,
Charit, is
yeah,
I'd probably also like to hear, or if he could let us know what kind of exercises he's doing,
yeah.
and one, whether his exercises are painful, whether he enjoys doing his exercises. That's very important, and also how, if he could just comment on how regular his exercises are, whether he has to do them daily, or what
Kusal,
he
I think
does.
and in addition to help Mervin, I think we need to see the bigger picture as well. What kind of activities he's involved in, in terms of work or leisure activities, because I think the information, it's true that we are getting a lot of information, but I think we need to probably drill into the whole picture. I mean, to get a better understanding of what he does, and then just like how you mentioned the 24-hour pattern, what he does in terms of work or any other activities and all that. I think that will give us a better understanding. Basically, I was trying to figure out whether he's trying to adapt into some fear avoidance behaviors, like avoiding pain, whether that is contributing to his muscle mass loss, because he's not actively using his lower limbs to walk or function as he would normally do without having the back pain. So I think probably we need to maybe know more details. I think out
Probably,
of this.
I'd probably agree, Dulan. And
Yeah.
right throughout the show, if Mervin can keep writing
Oh
his
yeah,
comments,
yeah,
that'll be really good.
yeah, yeah.
We'll learn a lot about him and
It's
his 24-hour pattern, his exercise schedule, and
correct.
we might, you never know, we might be able to help him.
Yeah,
Yeah,
yeah.
he has just written, said, even driving makes very difficult. That's, so guy must be in real pain. I know what it is. I couldn't drive. I couldn't, actually, I was telling you guys, I couldn't drive from my home to SLC, just to get treatment. It was so painful. I couldn't move. And I don't know what the hell it was. You guys were trying to figure out what's wrong with me. And as I said earlier, that with your help, I got little more mobility, but not still 100% ready to go, but I have learned to live with it. But seriously, I think I'm going to try sleeping on the ground, and if you think that's going to make a huge difference, I think that's brilliant. So would you advise, I mean, the mattress manufacturer is not going to like this, that would you recommend people to sleep on a hard surface, or is it can be detrimental?
Yeah, everybody's different, so you need to actually match the level or the softness or the hardness of the mattress to your own body. Everyone is different. In Australia, we work with a company called Regal Sleep Solutions, and what they do is, over a half-hour period, you get to go to their center and lie down on every mattress and see which one is for you. When you lie down on all these mattresses, the one that almost comes and hugs your own body and you just feel so comfortable lying there is potentially the right one. That's the first stage. The second stage is you trial it, and most of the mattress companies provide this 100-day
Money back.
sleep testing over the 100-day period. And within about 20-30 days, you can then work out and say, oh look, I think I need to go something firmer or something a little bit softer. So it's a bit of give and take. Oops.
Right, yeah, okay. Mobin now
Only
says,
opposite.
yeah, he says, now I'm only doing walking, biking, and just ordinary stretches. Life is very relaxed being retired. I think, yeah, was doing till about I was 62, a lot of dips and leg exercises and exercises using 5 kg dumbbells for arms. So he's complicated. He just lifestyle is completely curtailed. Being active. And what do you guys reckon? As you grow old, your background, the problems can get complicated, or it takes longer to heal, or what happens?
So usually what I've found, Charit, is it's a deconditioning. Usually if there's any kind of pain in the body, people are less likely, more reluctant. They're quite reluctant to do the things that we enjoy doing. So one of the key things I always say is go and do exercises that you enjoy doing. Go and do activities that you enjoy doing. For example, if someone says, for someone like Deepa, she said she really enjoys the Pilates. Other
Yeah.
people might hate Pilates, and if you recommend Pilates, they're not going to get the best effect out of it. So I always encourage people to go and do an activity that they really love. But as we grow older, there is a certain level of deconditioning that happens. It's either because lack of flexibility, because we're not moving the same way that we should be moving, and we're not conditioning or strengthening up the way we should be. One beautiful thing about the human body is until the day we die, we can build up strength. So the research has shown that the stronger third or the strongest people actually live longer. The body, I guess, to hold the frame, to get everything going, the stronger the frame, the better. So until the day we die, there's the opportunity for us to build strength in the body. But once again, you have to be smart. You only have to work with the flexibility you have, and then flexibility build on strength, flexibility build on strength, flexibility build on strength, and it's a natural graph up.
Brilliant. And
So, in terms of the activities what Mervin is doing, I
yeah,
would like to know whether he would like doing some water-based exercise, like going into a pool, because I can see that he's done like a lot of land-based and then
good, good,
weight-bearing stuff,
yes,
which does not
yeah,
help him. Through my practice, I have first-hand experience. I've rehabbed like a lot of my clients, and especially some of my elite athletes who have had like ongoing chronic back issues. Putting them into a rehab pool and then getting them to do various exercises in a pool. One example I can give you, first-hand example, is the former number one Sri Lankan marathon runner Ajit Bandara. He had the chronic back injury for about more than 3 months. No, more than 6 months, I would say. He was not competing during the time when I was in Sri Lanka. So we only did a rehab program specifically designed and done stuff in the pool. Nothing to do with weights or any other conditioning stuff, because with his condition it was very limited, the stuff which we could do land based. But trust me, you can check with him if you come across Ajit. We've treated him for about another couple of months, and he ran the 2013 LSR marathon and became fourth without doing any marathon running training prior to going and running in that LSR marathon. So he was like first, like three were Kenyans, and he was the first among Sri Lankans. He still managed to finish on top among the Sri Lankan athletes. We purely did a pool-based rehab, and he was pretty fine. And people were surprised, like how well he recovered. So this is
I think
just
that's a
one
really
thing
good,
we can
yeah,
consider.
that's a really good point, Dulan. Use of hydrotherapy.
Yeah,
When what we know is when the water is at your chest level, 70% of your body weight's off, which
correct.
means that all the tension from the neural structures, the muscles, joints, and ligament, the loading just comes off.
Yeah,
So someone like Mervin, that might be another solution, where he's doing a lot of land-based things, where he's utilizing a lot more energy than he should. And I think you're very correct there, Dulan. Within a matter of, also in a matter of months, and I'm only talking about month one, month two, you're going to get some solid results, because then you're aligning flexibility, control, core, all of it in the water.
correct.
And the other aspect about water is, water in itself has a lot of healing qualities. The other thing about Sri Lanka is, the you can there's the fact that it's a tropical country. You going swimming in the beaches is very therapeutic. The salt in the water has got a lot of healing qualities that are beneficial for the human body.
brilliant. I think Mervin. I think he says that that he has done bit of swimming. Just like doing getting into the water in a ad hoc basis is not going to help. I think you need proper supervision
Correct.
and
Absolutely.
competent physio to do
Yeah.
the rehabilitation part of it. Just getting into the pool is not going to cure you. You got to do it
No,
sensibly.
I mean, it has to be a structured program, and then again, it has to be specific to the problem, what the person is having, and then just like Kusal and I've been talking throughout this session, you need to identify again not only the root cause but all the structures which are involved as well, and then only you can probably make a tailor-made program. It can't be a recipe thing for each and every person, so you can't be putting up a flyer and say that okay, everybody who's having back pain just stick into this program. That might not work for every single person, so it has to be tailor made. Like you have to find what is
Yeah.
wrong with that particular person.
True, true, true. Shoaib, good to have you on the show, mate. Glad that you're enjoying it. Thanks for the positive comments. And since we are on water, just something that I always wanted to ask. The boss can contribute. What do you guys think of the ice baths? Does it really work? How does it work? Like if you got back pains, whether it's beneficial to anyone or there's freezing cold water. How does the body react?
Dulan, do you want to take this? I mean, you probably have a bit of experience on this with your athletes as well.
Yeah, so look, like especially again considering various different back problems, I don't think that we've discussed. So again, if there is especially disc herniation issues and all that, like cold seems to be helping quite a bit. But then what latest research has found out is that like for most of these issues, contrast therapy seems to be helping more than just using cold or heat alone. So what we do is like we put them in a contrast, like hot cold, a mixture of hot cold therapy, not just heat or cold. So, but various different conditions will respond differently, because for some people, if we say like, for example, just apply heat packs, their bodies will not respond to that. They will come back and say, no, my condition aggravated totally. So we will have to go back and see like whether cold is helping them. But basically, through my clinical experience and especially in terms of dealing with athletes, and then plus the research also backs it up. These days, what it says is contrast therapy helps in a lot of these conditions, and then contrast therapy actually helps to um, take the metabolic waste out of your system quite effectively compared to just doing ice bath or sauna or hot bath alone. So
Right.
it's a
Interesting.
combination of two things.
Deepa,
Uh,
what do you reckon? The cold baths beneficial
I
in your
find cold
experience?
cold really. But I wanted to ask Dulan, is this something psychological, the preference, or is it just the way the physiology reacts to the temperatures?
I
How does
think,
that work?
see, if you purely go by the physiology, then you know that what heat and cold does in terms of physiological reactions, and especially the school of thought is like if you have an inflammatory condition, then heat will make it worse, and probably cold is the best way to go about it, because to control the inflammation. Whereas if you think about muscle tenderness or spasm, so heat seems to be working well, because you need to actually facilitate the more blood supply to that particular part. But then you have to find the right balance between the two, because especially if somebody is having an inflammatory condition going associated with some of muscle spasm and all that, so what is the right treatment for that particular person, whether heat will help or cold will help. So that's why you have to trial it out and see. Again, you can't be like just labeling, okay, that this one will work for each and every person. So
I
I would not stick by just one particular modality or anything. I will again just go with I mean trial and see like what works for that person. If it's working well, I will stick by that particular treatment method, whether to use ice alone or heat alone, or whether to use a combination of both.
And
I think what
also,
Dulan
in
said.
my experience, Deepa, what happens when you have the contrast is you push. It's all about pushing your body and also the mind outside of its comfort zone. So you go from hot to cold very quickly, and it's like a shock to the system. So
Sorry.
what I know is when there is a bit of a shock to the system, the neural structures are a lot more sensitive, and it's then ready to function. So I think it comes down to uh, human nature as well, that us as human beings will always continue to improve when we're pushed outside our comfort zone, and it's the same when it comes to the contrast baths as well.
Yeah. Right.
And especially with sports, what I have realized is every single time I go into all these hot cold pools with my cricketers, because they force me to get into the pools. But what I have experienced is the next morning you will wake up like a baby, like really like feeling nice about your body, because that particular afternoon you might be feeling like really so, but the moment you have these kind of things done, the next morning you will, one thing, you will sleep properly that night, and next morning you will wake up like very fresh.
Yeah.
So that is very important, I think, especially for people who are doing sports, and then for anyone else as well.
Yeah. And, what I've also found is you don't have to do too much of it. It's only 1 minute on, 1 minute off. And you
Correct.
can repeat that up to 7 times, and you will get some immediate results after a good training session.
So you guys actually, for like day-to-day life, do you seriously, like, you recommend ice baths? But in certain places you may not have the both facilities. You
No,
you know
you
you
don't.
can't do both.
No, you can't. You
Correct.
can't actually have that charge. But at home, what I like to recommend is you start off with a warm shower,
Yeah,
and
correct.
then after a minute, just turn the warm off. Yeah, it's just cold water coming through, and then make sure you wet the head as well, because there's a lot of heat that escapes from the head, but you want all of that cooled off as well. And then after another minute, then you put the hot back on. Then another minute. So you don't need to actually have an ice bath as such.
Yeah.
But you can do all of this, with a simple shower.
Yeah, hot cold
Interesting,
shower.
really interesting. Now that's help. Anyway, living in a tropical, you can do that. In Australia, the water is freezing, but I
Yeah,
suppose a country like Malaysia and Sri Lanka, there's hardly any difference between the hot water and the water that is coming out of the tap. So we may not have the same the benefit. The could be different, but it's interesting on a day like this. A bit of rain around. You actually, I'm going to try that after the show. Bit of hot, bit of cold. It sounds great, mate, and I never thought about it. That's
It
it.
has
That's
to be. It has to be straight away though. Like
yeah, I know what. Yeah, I mean the switch has to be like
which,
yeah,
yeah, that's
yeah.
right. Yeah, yeah. And you need to feel like, see, if you're doing it right. Basically, what my experience is like, sometimes first time especially, you'll feel like ants running through your body. That kind of feeling you will feel.
Brilliant. Okay, Deeps, great to have you on the show.
Thank you
Before
so
you
much,
go,
Dani.
just what are your final thoughts? We have been wow, almost 1 hour, 1 hour 30 minutes. Didn't realize the time moving. Just great to have you, Deepa, as always.
Thank
Your
you.
your thoughts before you say goodbye to us.
Thank you so much, Dulan and Kusal, for bringing these new ideas and kind of like redefining how holistic health works. And I think it's really important what Dulan was saying, tailor making the program for the client or the patient. So that's key. Thank you,
Right.
Thank you for
good.
joining, Tiva. Have a good day.
Thank you.
Deepa,
Thanks,
as
Deepa.
always, yeah, always a pleasure having you, and hopefully that we'll catch up with you sooner than later. Oh wow, Somali is she
Thanks,
was
sorry.
okay. She's also there, is watching the show. Great to have you, Deepa. Stay safe and have a good week. Take care. All right, guys. That was Deepa. She's very versatile, isn't she? She's she's jack of all trades, mate. That she's into everything. Seriously, I didn't know that she's into Pilates, and all I knew was she was into martial arts, and that's she's brilliant. By the way, and more questions, Dulan. I think we covered most of the
Yeah,
areas that you wanted to talk about, and Dulan,
that's right. Like
but
probably.
there are more
Yeah, yeah.
questions coming in. Shorav wants to know, can you guys give some insight into a keto diet, please? So that's about diet. Guys can talk about that as well. I can't, we can't ignore all these questions, that are coming in. That the interaction is very important. And if you
Absolutely.
guys can just help Shorav out, and Mervin says renewed hope. We wish him well, and hopefully that he will get out of all these aches and pains, and that he'll be able to live a normal life. As we said earlier, Mervin, anytime you want to get in with these two gentlemen, and they will only happy to help you, and you can reach them, no worries,
Yeah,
either
yeah,
through this forum, or you can write to them personally. They will always be there. And what about the keto diets? And
so you want to say
I do
something,
not
or
know
you happy?
whether Sumali
I,
has any other questions. Yeah, boys.
Dulan, maybe touch on the keto diet from
Yeah,
your
yeah, sure,
perspective,
sure, sure.
from an athlete management perspective.
Sure, sure. I mean, keto diet has come up come up as quite a big revelation in the last couple of years, 2, 3 years, I would say. A lot of people have been getting adapted to this. So what keto diet is basically, for someone who does not know about keto diet, is it's a low carbohydrate but high fat, with a balanced amount of protein. So you pretty much try and cut down on the intake
Carbs.
of carbohydrates.
Yeah.
So the main purpose is to lose weight. That's the main purpose, and also to, if someone thinks that they need to get fitter and stronger, it is one way of increasing the lean body mass by trying to lose the unwanted fats in your body. But the thing is, like, lot different kinds of these keto diets and recipes have come up in the market. But my main thing and the point I want to stress is that whatever food item you will get from your supermarket or whatever, whether it's a pre-cooked one, I think it is quite vital that you read the labels. This is to do with what kind of proportions of different nutrients and other stuff which are included in that particular product. Because just with the keto diet, because it's a high fat diet, and then I think you don't have to really go into a keto like that labeled as a keto diet. But if you can try, and anybody, even with the food products what you get in Sri Lanka, if you can try and avoid like a lot of carbohydrates and plus the sugar. Sugar is the main thing. I was chatting about this with Kusal the other day. Nobody puts an importance on the amount of sugar we take. We think the amount of like raw sugar which we put in the tea and then have 2 teaspoons of sugar in the tea, that is the sugar what we're talking. But if we think about the biscuits and whatever stuff, even the milk powder, if you read the label behind the milk powder packet, you will see how much of sugar that is included in the milk powder packet. And here in Australia, we get like products which says in the front label no added sugar.
Yep.
But if you go and check the label at the back, you'll see how much of sugar which is included in that product by itself. So which can be harmful to your body. And then people, for example, the fruit juices, they market it saying that there is no added sugar. But then if you go and read the label at the back, you will find out like how much of sugar which is there, which again turns inside the body like into unwanted fats, and then that's how you can keep putting up on weight. I think see going on a keto diet again, like if you have to like really go onto a keto diet, it can be a bit hard for someone who's used to, normal eating habits. But what I would say and suggest is like, rather than trying to embrace a keto diet as a whole in the beginning, just try and cut down on your carbohydrates and try and increase on the natural fatty based food, but try and cut down on the sugar levels as well on the same time. Because if you just try and cut on carbs and still take a lot of sugar, it's not
Yeah.
going to serve your purpose just by like sticking into a keto diet just because the name is saying. But because the sugar will again turn into carbs and then deposit in your body as unwanted
True.
fat in
True.
the long
Yeah.
term.
Yeah.
So it is not about the term. I think it is what you take, what is there in that particular. I mean, the food or the stuff you take. I think it is very vital that we have the habit of reading labels before we buy product. I don't think anybody has the habit of reading labels. In Sri
Right.
Lanka or in Australia, most of us don't read the labels.
Maybe a Sri
So
Lankan habit that is. Kusal, you want to add something to that? Somalia.
Yeah, actually, in terms of there are so many fads out there, different diets, different things to consume. Every body is different, and what you want to do is the food that the food intake should be the energy source to get your body functioning. So it's always I don't recommend going after fads. I don't recommend going after certain diets. I'd recommend trying to research as much information as possible on what your requirements are and what food requirements you need. Now, I mean, nutrition is a huge, it's a huge expertise. It's kind of like having a cricket coach. You don't learn everything, from books or watching TV. You need to actually see a coach and then learn. And in the same way, if you feel, well, this is the requirement I have in performance, and when I'm talking about performance is everyday life, I want this amount of energy, I want to feel this, or this is what I want to feel during my workouts or post workout, or in everyday life, then go and speak to a dietitian and get some information that way.
Yeah,
Correct. And
interesting. What Somali says is, according to Ayurveda, no diet should be done for a long period of time. All you need to know your also you need to know your body constitution. Because if your body constitution is, now this is where it's getting very interesting. Water. I don't know whether you guys, what you guys have to say about it. Then you should not continue green vegetables for a long period. Now I didn't know that. That's then she says, as it makes degenerating disorders. So what she says is, if your body is water, you should not be eating too much vegetables. So does the other constitutions, which is say there are times of pitta and kapha aggravation during. These are all yogic terms. I think water, pitta. I don't know what the kapha. The water, I believe, is air. Pitta means, I think, I don't know. Bile, I don't know. Pitta, vata, pitta, and there's a kapha. If Somali can explain that. Interesting, isn't it? There's that's how they define that. Your body. What basically what she's trying to say is, the little knowledge that I have, say that the body is divided into these three segments. That the certain foods that you eat could react differently if you don't know what your body type is. That's very interesting. That what you
yeah,
guys
yeah,
think
correct.
about it. Yeah?
Correct. I think same thing Kusal was trying to say as well. I think you shouldn't be like, just because there is something called keto diet, you should not be going and just having it. Like, you need to find out what is right for your body. Again, like I think that is the same thing. Pretty much, Somali and Kusal both were trying to say. I would say so. You need to find what is right for your body. You can't be just doing something because it is just out there.
Yep. Also, they have clarified pitta, as I thought. Pitta is bile, I guess,
Oh,
and
right.
yeah, kapha is phlegm.
Oh, okay.
Yeah, the three segments. That is
Thanks for clarifying.
vata.
I didn't have a clue of what it was.
Yeah, vata is air.
Yeah.
Pitta is your bile,
Uh-huh.
and then phlegm. Yeah, too much
Then,
green vegetables. Kapha is pretty. And wow, she's writing Hindi, I think. Agani and Jala, and Vata is Akasha and Vayu.
yeah,
And
probably.
I think
Yeah.
Charit, this is a very interesting thing because we are talking about physiotherapy. We are talking about our sort of expertise, and Deepa has that level of expertise. And the beautiful thing about what's happening in the world and is this understanding about, as I said, the connection between the East and the West, between some of the ancient practices and what we have right now, right? I think it was Yasiru who had asked one of the questions on, what's the difference between a chiropractor,
Yeah,
osteopath, and a physio,
yeah,
and which one is most effective. Now, if I can just explain, just on physiotherapy, physiotherapists, we study the human body, the muscles, joints. Then there is the cardiothoracic, which is the heart and the lungs, and then there's the neurophysios who handle the brain. And this is one of the reasons why physiotherapists are allowed to work in hospitals. They cover the whole body in our training.
yep,
Chiropractors in Australia, I believe the course is about 5 years. They cover intrinsically on the muscles, the joints, the ligaments, the energy systems, the alignments, the spine. And in osteopathy is the same, where they look at things like muscles, joints, and also how utilizing exercise. Now, which one should you choose? I tell people that they should choose the one that helps make a difference in 3 sessions or less. And this is, right across the board with any practitioner. You can go and see someone. I've seen people go and have the same treatment for 6 months, 10 months, sometimes 2 years without any change, and they're like, "Oh wow, I didn't think for a moment that I should change a practitioner." But the mantra that I've always used, and when I'm actually teaching my students, is, you want to try and make a difference to that person in 3 sessions or less. Now, if we look at back pain as an example, you might never be able to solve back pain in 3 sessions. But at least if you've come up with a plan, if you've come up with some direction, provided an exercise program that you can then evaluate, then you're almost there with that kind of thinking. And the other thing I want to touch upon is that, when it comes to health and well-being, when you think of this as 3 sessions or less, you're making yourself very accountable to providing the best health care for that person. Uh, one other thought I want to add to this is, in your own car, if your own car, you have a problem, you take it to the mechanic, and the mechanic sends it back saying, "Oh, look, you got to bring it back next week." "Oh, yep, bring it back next week again." Or, 3 months later, you've gone back a fair few times and the problem's not solved. I think after the second time, you will be changing your mechanic. You have to think of your body like a car, where if you're not getting a change, if you're not getting the response, then you have to change. And, it's really wonderful to hear of Deepa's expertise, how she would evaluate things. And this is what we even do in Australia. We come at everything with a multidisciplinary approach, that there are these experts from other facets of the human mind, body and soul coming together to provide a solution.
Brilliant. Yeah, I mean, that's the way it should be, isn't it? Like the East meet West, this is the problem, as you rightly said. Sometimes, that, if you don't know the area Somali is coming from, and in the human tendency is that you just write it off and say, it's garbage, rubbish, and it could be probably, that she's right. And, everybody's right, it cannot be wrong. And if it works for somebody else, and give it a go, without just, saying that it's all, it's all jargon. But it's the first time, I have heard about these three, which is called Vata, Pitta, and what the other thing that she was talking about, phlegm. Basically, air, bile, and phlegm in English. It's a very interesting aspect. And I just realized that, that what she's trying to say is the certain foods that you eat, if you belong to any of these categories, it can have a direct impact, on your body. Just only you will know. So that's why, so people say that some people, it's a common belief that the boys have in the team, that most of the guys don't eat beef at the moment, Kusal. In Sri Lanka, lots of people don't eat beef. They have gone away from it, and they eat chicken and fish and stuff like that. And in their minds, they feel that that they're weak, that they have lost their strength. I seriously don't know whether actually they have lost strength because they stopped eating beef, that they are not getting the required amount of protein into the system, or it's just a mental thing, but only they know that. But I don't know. Even in my case, all I can say is, from my own experience, I feel different once in a way if I eat beef. There's a massive difference in the body. I suppose the human body reacts. It has more protein than any other meat. It can help you. So I think that the same manner that if your body can't take green vegetables, and if you keep eating vegetables, that the body is going to, that you will have the runs and you feel different. So only you know what is best suited for you. That's better to be aware of it, conscious of it. That's what she's trying to say.
Yeah.
So, Charit, is that like more like a religious reason that they won't eat beef in Sri Lanka? Personal choice.
It's a personal choice. It's a personal choice. That basically, I think lots of people have gone away from that. I don't think the boys, like in India, is nothing. There's no disrespect to anyone in particular. That I don't think a cow is considered sacred over in Sri Lanka, just the way like in India. But I think it's just the influence, that it's not, the people over the years that they have gone away from beef big time, and and just sticking to chicken and fish. Some people even don't eat chicken anymore, because the chicken what we find in the market is broilers that in 35 45 days, you produce these chickens. Lots of people, they have their doubts about how how could you, like a from
I was
in a
Yeah,
in a
I was actually going to talk about this, but then
yeah.
because we did not get up to that stage, I think, and then we've come up with a lot of different things. I kind of like just did not get an opportunity to talk about it, because like what I have realized is like this could be very controversial to bring up as well. Like all this like broiler chicken, they use a lot of steroids to make them bigger in a short period of time.
Yeah, 35
Uh,
days.
One thing I have actually come across first-hand information from Sri Lanka is like when I was working in Sri Lanka, young they found it in a study in young girls that they attain puberty like really quickly, like in a very small age compared to some years back. Because one reason they found out is a lot of these kids eat broiler chicken which had steroids injected,
Yeah.
and the consequence of this is like at a later stage of their lives, they could potentially have the risk of developing conditions like osteoporosis later in their life because of long-term consumption of these kind of food products, processed food products, which has excessive amount of steroids in them. So, I mean, it's not a good thing in terms of, I mean, any country or any food habit as such to have that kind of a practice going on. But then, what can you do to stop these kind of practices? You can't do much, isn't it?
Yep, it's very interesting. There are lots of messages still coming in. It's the what you eat. It's not only your body. It's your affect your mind and thoughts. And good to have Deepa Lahangam on the show as well. Deepa says, if I remember right, Vata, Pitta, and Kapha are the three life forces. Very interesting topic. The West started to investigate these Ayurvedic disciplines in the 80s. Yep, and I think he's right. And then again, Sumali says, when you are young, you should eat anything as your metabolism is very good. You age from birth to 20 years in kapha and pitta. So you need to eat all as it where you develop your body. So I believe it's common sense, isn't it? You can eat anything and can get away up to the age of 20. The problems, all the problems start coming in, once you go past 40, that you lose your eyesight. It's a very common thing. That's the first thing where it starts. And then come back problems, that we are discussing about. All those complications come in as you grow old, and how you gracefully, that's the challenge, I think, for any human. How you grow old gracefully and without the complications, simple as that. Oh, that's another question. That Leslie, wouldn't cooking the meat get rid of steroids? I'm not too sure. What do you think, boys think?
I don't think so. I'm not sure. I mean, I can't give a definitive answer, but I don't think so.
Kusal, your thoughts?
I think everything comes down to the level of natural foods to processed foods, Charit, and something that we see a lot of now. And to give you an example, even in Melbourne, the loaf of bread now could last something like 2 weeks, without even being in the fridge. But going back about 10 years ago, you could only leave it out for 3 days. So, there's something that's changing. It can't be surely the technology of the bread that's causing all of this. But we have become a world where it's all about the processed foods, and we have to be very careful of what we consume. Because even if we get the performance pyramid right, the 5 things, then we get our 24-hour cycle right. If you don't get the nutrition right, which is the energy source, and just as you said, Charit, you might eat the meat and you find that your exercise levels are a bit better. I think if you can continue to monitor yourself on your different tests that you're doing regularly, and then continue to evaluate everything that you're taking, and then even work on looking at how natural those products are, then you're closely defining what you're taking to the outcome. And then you're not really also worried about the uh, we classify it as the mental side, where it's like a little mental boost, thinking, oh, was it the actual meat that caused it. So you're removing that factor out of it. So one, removing the processed foods, very important. As Dulan said, reading and understanding the foods that you're taking, really cutting down sugar. Sugar is a big problem. Sugar is pretty much like the next smoking. When our grandparents' time, smoking was the norm. It was a form of relaxation. I think even in the world wars, they were handing out cigarettes to the soldiers just to help them relax, which had all these other problems. Then sugar is another big problem there. So
So what you're
um,
saying is, mate, sugar, even in small quantities, it's a no-no, is it? Is that
No.
what you're saying?
look, I think overall no, but everything in moderation is what I'd like to say. Because
So basically,
the body gets used to a certain level, and then if you try and completely shut it down, you're going to have a lot of withdrawal issues, and then then productivity goes off
Moderation.
as well.
Yeah. Okay.
yeah, correct. I
Great.
agree with that. But then that's how you gradually taper. I mean, if you're used to taking a lot of sugar, that's why you cut it down gradually, not in one instance.
Yeah.
And recent research has found out that what your body requires in terms of daily sugar intake is like 4 grams, just 4 grams. That is one
Which
teaspoon
is
of sugar.
one teaspoon. Yeah.
That's negligible, isn't it? So
I mean, I
if you
mean,
have one,
we take like way more sugar than that, like easily a single day.
yeah. So
At
what
least,
you are
at
saying
least,
is
at least
basically,
minimum
Dulan,
100 grams of sugar
yeah.
in whatever way it comes.
Wow. What you are saying is basically like what they sell in, if you boys can remember, in Sri Lanka, one milk toffee. That's it.
Yeah, pretty much.
That's it for the day.
That's it.
People out there listen to these guys very carefully, and the Somali comes with very very interesting quotes about eating beef. She
And,
said,
and what I wanted to stress is like this is uh, Professor Peter Bruckner, who was the former head medical doctor for Cricket Australia. He's a big advocate of cutting sugar by half campaign,
right,
and so he actually has told the biggest challenge he's faced so far in campaigning against this sugar is the soft drink companies,
yeah,
including Coca-Cola, Pepsi, and all these major multinational companies, because
yeah,
they are, if they could get him killed, they would pretty much get him killed, because it's about the money. Because
yeah.
when someone like him advocates about this kind of stuff, people will tend to listen and then cut down. and they have been on his back for advocating cutting down sugar levels. But it's quite alarming. I think we can talk another day, probably a couple of hours on this matter,
Yeah,
because
mate, these questions keep coming in, so we need to keep our answers very,
yeah,
very
yeah,
short.
yeah, absolutely, absolutely,
As
absolutely.
Yasiru says, I managed to lose 28 kgs in 5 months, which made my BP come back to normal. I consumed lot of dill seeds, as I was advised by an Ayurvedic doc. What do you guys think about dill seeds? Dulan, anything to do with you? Dill seeds, mate. Sounds like
Um,
your name.
I haven't come across or tried it, so cannot comment. But
We probably
basically, if
will have
someone's
to
had the
ask
result.
Somali what these dill seeds are all about. Well, I think as you rightly said, mate, if that something works for you, go for it, isn't it? I don't know. I don't know. That's what
And
I
and
say.
and one thing I can actually touch base is the rescheduling of meals and workout. I think that is proven to be giving results for most of us, because usually we tend to have three major meals, and then as Sri Lankans, we eat quite a lot. I mean, a portion. So
Yeah.
what they say is be portion wise. So you don't need like to eat a huge plate of rice with like a lot of curries and all that. And what they say is, in order to maintain a proper metabolism, it
Yeah.
is good that you eat like small portions at least 5 to 6 times, and then again think of what is in there in the plate.
Yeah,
So
good to
instead
have
of just
Bilal.
one,
It's good to have Bilal, watching us. If you guys remember Bilal Yusuf, good to have you
oh
on the
yes, hi
show, man.
Bilal, good to
Big
see
hi
you.
to him. Bilal says, in my experience, people over 40 jogging is also contributed to lower back pain. Would conditioning of your feet be a safe option? Guys, quickly.
I think we touched
Yes,
on
I
this.
think it comes down to technique there, Charit. So if they get the technique right, that's a part of it. But also getting a person ready to run, it needs to be increased. Usually, my experience is increasing 10% every week is a good way of conditioning them up.
Right.
And also just touching on something which Kusal has mentioned a while ago. Very important to see the whole kinetic chain as well, and then especially if people are complaining of back pains after jogging. My thing is, I will go with the feet plus I will check the footwear as well. So sometimes improper footwear has a major contributing factor to getting knee pains, hip pains, and back pains in a lot of these people. So I would end up checking all that as well. Feet plus footwear also. Most of the time, I'll get them to bring the footwear they use for exercise and jogging or sport, whatever it is, and I will have a proper look. And then if I think that my scope of practice cannot help the person, I'll put them to a good sports podiatrist who
Brilliant.
can
I think
help them.
I need to look at my feet gets very sore after jogging. I have changed my. I think Kusal perhaps remember that in Aussie. I was struggling with. I have tried all types of footwear, and it has not helped much, mate. My feet gets very sore, especially just behind the toes. It gets very. What can I say? Becomes very soft. Actually, I can massage it off myself after training once I take the shoes off, and it's kind of like a liquid formation. It gets inflamed. I don't know why. That's a. Is it okay to run barefoot?
Yeah, so barefoot running is probably the most natural thing to do. But the issue with that is from a young age, we are being given shoes. So
Yeah,
we don't walk around without shoes as much. So even if you are spending time without shoes and then you want to go for a run, that's a huge increase in loading. So I don't recommend just going for a run without shoes. You want to try and possibly even walk around the house first,
yeah,
do it in 2 hour blocks, build it up. And as I said, that rule of thumb of increasing 10%
yeah. Got it.
of
Yeah,
duration every week, your body just gets continuously accustomed to it.
true, true. Well, Uluhal. It's Dil Seed is Uluhal. Well,
Oh, right. Yeah, yeah,
yeah,
yeah.
okay. That's what it is. Let's just say sugar production is controlled by a cartel, which is worse than the tobacco industry. Which is right.
Yeah, absolutely.
Yeah,
Absolutely.
absolutely. And Deepal is saying, what do you all think of Qigong? I think it's something Qigong. Any idea, boys?
Qigong. What is Qigong? Is
I
it a
don't know
Tai
what it
Chi
is.
sort of?
Yeah, it is Chinese. Yeah, I think it's
Oh, right.
something very
Yeah, yeah.
similar to Tai Chi.
Yeah.
Yes. Yeah.
So actually, Tai Chi is considered to be one of the main things to help prevent osteoarthritis in the body, and it comes down to the breathing mechanism, the slow movements, and doing everything with such good control. So Charit, we were touching on form, getting seeing how a athlete or a person moves well, and Tai Chi helps promote that at the lowest intensities, and it's very good.
Yeah, I think Qigong is very similar to Tai Chi. That I have done a bit of Tai Chi, in the past. It's brilliant. I've seen a couple of this before this whole COVID thing. We used to have a group of Chinese, exercising at Independence Square. They're all pretty much in unison, and the motions are unreal. I think if it's very easy on the body, it's very graceful. I would advise anyone any given time, if you can give it a hand, give it a try. I don't know much about Qigong, but I know a bit of Tai Chi. It's brilliant. It's absolutely fantastic, and it's highly recommended. All I can say, Deepal, if you want, that's what you want to know. And
And
then
also Charit, with the spine and with Tai Chi and all these movements, slow movement, it's a spine rotating and these lateral movements, because we're trying to bring back the three movements that we were sort of born with. And I remember, I think Errol Bird had asked a comment about golf and some golf
yeah,
stretches. One of the best things to do in preparation for golf is, getting these rotations happening. So crossing your arms and, rotating left to right with, you only have to do 20 and then sideways, and you can actually hold a club and do this. If you do 20 a day, and you do you can do that up to 3 times, you'll find that your golf flexibility through the swing really improves, and within a matter of 7 to 10 days, you're you you don't need as much warm up time to get into your golf. So usually it might be the first 3 or 4 holes that you end up warming up to, but within the first or second hole, your body's completely ready.
right, great stuff. I think Sumali has done the needful. He has answered Mervin's question: what a person can eat after turning in after 60. The very short answer would be eat natural. Eat food that is easy on your digestive system, and it's going to help. Because your metabolism slows down after 40, 50 years. And a very interesting question, boys. I think Mervin is trying to be funny here. Does active sex life harms your bones after you have turned 60? Wow.
Only if you're not enjoying it, Charit.
Yeah. But probably I would say it's too early for us to answer because we have not yet reached 60.
True, it's too early for me to answer as well. Just so I would leave it to Mervin's imagination. What's good for you? I can tell you one thing is, I read somewhere that the whole I saw some Canadian health they some like an institution the promoting. It's called a glory hole treatment. They are where you stay away from your a partner, and they were promoting it. How to have safe sex without without getting infected with the COVID. Marvin, I seriously suggest you try that, mate. It'll be very easy on your body, and that will preserve your bones as well. If that's that's the well the Leslie says ask Hugh Hefner. I think unfortunately he's not around, so so we can't do that. But try that, whatever the Canadians recommended, perhaps it will help you. Then Deepa Lahangam, I was trying to get offline, mate. The questions keep coming. Footwear is one issue, but a podiatrist will let you know if there is a imbalance to your body. Example, like a table feet, which they are of different lengths.
Yeah,
Is that right?
absolutely. But the whole point is like someone needs to identify that there is an issue, right? How will you know, like if you don't identify that there is an issue, like nobody will know what like someone has to diagnose or find out there is an issue going on, right?
Yeah, unfortunately, I like in Australia, boys, in most countries that when you buy there is a foot doctor you can get your foot examined. They are aligned, so they will tell you exactly the what kind of shoes to buy. I don't think in Sri Lanka we have that facility as yet to check what is best suited for your feet. I can't recall. I remember the Asics. They used to have it. You can check your feet. What's the best suited for you, and they will tell you then and there the pair you're buying. That's the right pair. But here I think guys buy on spec and that leads to a lot of issues. That with your where your heart with the what is the technical term, mate, with the high arch or whatever that shoes are recommended. You boys know it better than I do.
Yeah, I think once
Yeah.
again, Charit, it's the assessment of whether the feet are the problem. So
Yeah.
usually, if you end up buying a good pair of shoes and then that actually solves your problem, then the problem was coming from the feet. If
Yeah.
you bought a good pair of shoes and the problem still is there, the problem is still there, then you need to work up that chain to see where these issues are coming from. And I also, tell my clients, you know, don't give up just because the pain is still there or the problem is still there. Don't give up, because if if I can't find the solution to your problem, I will find an expert out there who could provide you with the solution. And I think that's the mindset of what I teach with my students as well, saying, you're not going to be the be all and end all to this person. Everyone's different. You might be one part of the solution to this person, and then you have to look at everything in a multidisciplinary approach. And then if you can't solve the problem, recommend others to help a person.
Wow, this is becoming very interesting, mate. Suddenly, our whole conversation has gone in another direction. Sumali says, "You boys got to listen to. Probably Dulan can see it.
Yeah,
That's a little embarrassing to say this, but what to do? It's a live show, but people have written. So I'm gonna touch upon it. It's really funny. According to Ayurveda, your Chakra Dhatu does not go to waste if you don't use it. It goes back to your body and it makes your body have more endurance. Same goes to women. Their egg, if not used, it is consumed by the body. This process makes ojas. Ojas is endurance. Guys, very interesting. The boxers, I have heard about these boxers, that they isolate in general, let's say all athletes. What you seriously believe that the isolating an athlete and keeping away from him or her away from any physical activity with a partner, does that make them stronger? In your scientifically it has not proved.
I haven't seen the research on this, Charit, but some athletes really want to stay away, so their focus levels are really heightened. Others, they want to have a sense of being calm and relaxed. So I think once again, everyone's different.
yeah.
Yeah.
And then probably you have to think the bigger picture as well, not just the physical thing here. See, for some people to have that physical relationship gives them a lot of psychological pleasure, and then positive vibes in terms of their psychic. So that's why, like for example, the football players here. Now they are based in quarantine stations and then they in hubs for this season. So a lot of them have requested their families to be traveling with them, and then so they get to spend their time, because I think that is something to do with the fact that they believe that the best out of them comes out when they are with the families and when there is that connection going on. If they were separated, then again this psychological thing would have come into play and not just the physical component of it. So we can't be thinking of one thing alone. I think that we have to see everything in combination, not just the physical factor, but the psychological aspect as well. So
Yeah, you
physically,
got it right.
it might be proving to give good results, but then what about if the person get depressed of being separated? So
You're
how
right,
it
and
goes
I
then?
think the whole concept came, from the boxers. And I think the good old fashioned old school trainers used to isolate their boxers. The term "eye of the tiger," so you really frustrate the guy and you
Hmm.
keep him away from everything, and his mindset is just go out there and kill. So I don't know scientifically. I spent a lot of time, trying to get some idea, gain some knowledge about this whole thing. As Kusal said, I don't know scientifically whether it's proven. Engage in sexual activities 24 hours prior to a event, whether it gives you any edge over any other athlete, and I wouldn't know. Whether it makes you stronger, well, that's debatable. I don't know. Big hi to Renu, all the way from New Jersey, USA. Yes, good to have you on the show. And well, there's uh, this is becoming hilarious, mate. This guy says, that too much whatever dhatu causes cancer in prostate. I don't know. Again, we are not qualified,
Who
qualified
said
to.
that? Like I can't even see
It's
it.
Mervin's philosophy, anyway. I think
Oh,
probably, that's the problem Mervin has. Bit of relief, might give him, less back pain. Mervin, you got to seriously think about it, mate. The I just don't know what's going on. The statins consumed for high cholesterol also seem to cause muscle and bone problems. Is that right, boys?
So one of the issues right now, my PhD student is investigating the role of statins for blood pressure, and or cholesterol. So one of the issues there is actually a cognitive issue, where there is a cognitive decline with people who are on statins over a longer period of time. And the final part of the study now is to identify whether exercise can help one, that cognitive side, but also we're trying to identify whether there is issues with the muscle tissue, flexibility, and all the other functional things that go into health and well-being.
Right, right. I think there's there's so many other comments. I think I've lost some of it. I can't keep a track of what is going on. And training an athlete, it just turns up on the day and that's it. I don't know what that is. Dulan, can you see that, mate? I can't see that.
Yeah, right. What Leslie is saying is, I think it comes from lack of self-confidence in their training. He says elite athlete just turns up on the day and that's it.
Yeah.
But then you have to think that elite athlete is also a human, right? So they, at the end of the day, they are human as well. So I mean, you can't just say that okay, they have to just turn up and perform. That they will be going through similar emotions and all that things like what a normal person, like I mean you me go through not being an elite athlete. So you have to be considerate of the psychological fact as well, which I think in Australian sports that we have been putting a lot of effort in. And um, how much cricket has put an importance into the psychological aspect is that they have actually Cricket Australia has recruited a person to look into the mental health and well-being of the players and the staff, especially
Yes.
with the
Yeah.
COVID going on. So
Yeah.
you can't like just put it to the fact that somebody is an elite athlete and then they would just have to come and perform. They are just like you and me. I would say that because in the recent past we have had like a lot of players coming up with psychological issues and then complaining, and they are elite athletes and who have performed really well for not only for Australia but for their respective states as well. So we have to weigh in that as well. It's just forget about them being labeled as elite athletes. You have to treat them as another human being in their
Absolutely, mate. Yeah,
aspect.
very important point. In fact, I brought this up with SLC sometime back to have a person permanently employed, because nobody knows. The people don't understand out there what these athletes go through. And
Right.
in my own experience, it took me a very long time to understand the stress levels, of these athletes. And I'm
Absolutely.
very, I'm saying it now, I was like totally amazed to find out some of my boys in the squad had big depression issues, mental issues, and which I wasn't qualified enough to handle them. It just so it's very important that we look at that the mental aspect of all athletes. And if you just as rightly said, if you brand them as elite athletes who can turn up on the day and deliver, no, that's not the way. It's like going back what we spoke about. It's mind, body, and soul. Whole package. It's just not one thing.
I think
And
being labeled as an elite athlete itself is a burden on their shoulders because there is a lot of expectation.
yeah,
Because that is how the outside world sees them as right, elite athletes. So there is a lot of expectation.
right, boys.
So
Before we wind up, just Kusal, and you have written a couple of books on back pain, and that recently you had a, like, if I can get a shot of that, that your the book that you have written, Happy Back or Back Pain, or one of those
Yeah.
books.
Yeah, I've written 3 books, Charit, and I specifically wrote on back pain because I've been a physio for over 20 years now, and I think I've consulted over 60,000 sessions. In those 60,000 sessions, 80% have been on back problems. So I put
Right.
this book out to showcase to people what they can, what back pain is, what does it what causes it, why you're getting it, and then some solutions on what you can do at home
Yeah,
to
this is
help
the this is
prevent
the
it.
book. This is the book,
Mm,
right? Yeah. Okay.
that's right. So that's available on Amazon, and it was created in a very nice format with images and pictures and exercises, and it was a couple of my athletes. Opening the book up, you'll see all the exercises. There's a couple of my athletes who are showcased in it. So it was there as a resource for people to help themselves.
Brilliant, great stuff. And all your books. Mervin is asking where can they buy the books. So it's I believe they're all available on Amazon.
Amazon. They're all available on Amazon. And if you just Google Kusal Gunawardena and just put Kusal Gunawardena books, all my books will come up.
Great stuff. Just to give if I can find your other book and just to give you a bit of exposure. If I'm not mistaken, one of the books. There we go. That's written in Chinese, isn't it?
Yeah, so that's the 3 minute workouts. There was another book where you don't actually have to exercise 30 minutes a day. Trying to that's what the World Health Organization recommends. But we came up with this 3 minute program, and you get the same effects of a 30 minute workout after 3 minutes. So the number one excuse people don't exercise is time. And you know what? In the 50s and 60s, it was the same excuse. It was, people didn't have time. So when you say that an exercise program is only 3 minutes, time is removed. So people are more likely to do it. So the three books there's 3 minute workouts, there's a back pain. And then I've combined the third book, which is exercise and meditation, mindfulness, which was co-authored with Helene Finizio. Helene is a meditation expert to billionaires in Los Angeles. So it's about how exercise and also the mindfulness side comes together for the best outcomes for the human body.
Right, great stuff, mate. So, before we wind up, I think Dulan had an interesting. If I can find that clip, that he compiled everything that we spoke about into one particular slide, and we can quickly summarize that the both of you can touch upon that. Let me see whether I can get that slide. Yeah, got it. Yeah, it's coming up. 10 facts. These are, I think, basically what we spoke about in general. That we covered most of these the points that he has highlighted. If you can just summarize between both of you.
Yeah, sure. I think we've touched based on almost everything throughout. So just like we both have reiterated, exercise is found to be helpful, and we are not just saying this, but the research is saying, and no one is recommending rest these days, but to keep moving. So that's the second point to highlight, because movement has found to be more helpful in back pains than resting. And again, exercise can prevent recurrence of back pain. So this is a proven factor as well. When your problem is found and then it is dealt with correct exercises. And also, what they stress is moving with confidence and without fear is very important, because again, we have discussed this throughout this chat. When you have that fear and that inferiority complex, you tend to like wind down. So, but whereas we always advocate and then promote like being open, broad, and then like move with confidence. And the other thing is like when you have that fear, you tend to like tense up a lot. All the structures, not only the muscles, but the nerves and other structures will tend to get tensed a lot. So, which is not helping with your back pain. So that's why we say like move free, move with confidence. Then that's important. And number five is exercise in a relaxed manner is very important. Just like how Kusal has just mentioned with his book, I think that's what he's trying to advocate in terms of incorporating exercises with being mindful as well, incorporating things like yoga and relaxation techniques. I think that is very vital as well to overcome back pains. And the best type of exercise is the one you enjoy. But having said that, you have to be a bit mindful whether that could cause some damage to the structures which are involved, which in turn would aggravate the problem. So that's why a qualified healthcare practitioner, um, including your physios, can come in to help in giving you the right direction of choosing what is good and what is not. And number 7 is feeling sore after exercise doesn't indicate damage. So what we call is like even post exercise after a few hours or a day is DOMS, like delayed onset of muscle soreness. So that is quite normal to have. And the strategies we've already discussed, I think, in terms of choosing between cold, hot, or contrast therapy, which works well for that particular condition in that particular person. And this is very important as well. We both have been stressing on this number 8, exercising regularly is a must. What most of the patients tend to forget is after a while, when their symptoms improve, they think that everything is okay, but it is not that. So you need to still concentrate and do your stuff on conditioning for a while, and the exercise has to continue even if you stop coming to see a physio for the hands-on treatment. And basically running on the road and breaststroke were considered to be bad, but yeah, the studies have found out that there is no adverse effect in doing these kind of activities. And the last thing, I think Kusal stressed on this as well a couple of times, no drug or tablet delivers the diverse range of benefits as exercise. So people tend to rely a lot on painkillers these days, I think, and then they end up getting used to. I have come across a lot of my patients who started with the, I mean, lowest possible dose of painkiller and then ended up with the strongest possible painkiller, and they're still on painkillers. They live on painkillers, so that is not the solution for your, especially for your back problems. And I think the audience is clear of everything what we have discussed. And it is not just one thing, but a combination of a lot of things which can help with your problem, just like how I've summarized in this last slide.
And Charit, I just want to finish off with we were talking about things like biomechanics, what happens in a 24-hour cycle, nutrition, and then the mind. The way it all fits together is if you have a band, where you've got all the band members ready to play, that is getting your biomechanics right. After you get your biomechanics right, it's about then them creating good music, and that's what happens when you get the 24-hour cycle going well. If you then get the venue right, say it's a wonderful venue, um, and then that's the nutrition. So then everything gets amplified a lot better. And then the final component is when you have the mind right, everything is in a beautiful auditorium, and then it's with the lights and everything. So the band is then flourishing and just creating the best music everyone is enjoying, and that is the human mind. So that's how those four things piece together.
Brilliant, guys. It's I think this is the biggest, the marathon, the longest show that I have ever had. In my career, talking to people, I didn't realize 2 hours 24 minutes basically, and we haven't even spoken about lots of things that I wanted to bring up about the number of back pains. I know that it's just not just you can't categorize just lower, middle, or back pain, and yeah, so many sciatica nerves and all those. But in a nutshell, I think we basically we spoke about how we address the treatment wise. Always get to the root cause, what it caused, not on the symptoms alone, and lots of important things that you boys contributed, and which I learned in the process. That we learned a lot about the things we did not know about Ayurvedic, the whole holistic way of looking at it. Deepal is still talking about Qigong for back problems. Yes, of course, Deepal will have a look at it. I still think it's something similar to Tai Chi, and that's a That's very good. There is no absolutely no issue, anything, and I just absolute respect for those Chinese whatever traditions that they have been doing. And it's big thank you to Mervin and rest of the guys, Sumali, Deepa, being on the show, everyone from Shorab. I don't know how many people who has written that, and wherever that you need assistance, I'm sure Kusal and Dulan will be happy to help you, and they probably will, if there are any queries that they have missed, I'm sure that they will respond to you accordingly. And great having you boys. I hope that you will come out of your lockdown situation, and that we'll all be happy like one day and get back to our normal lives, and get on to live like normal human beings. Being caught up, being cooped up is not the way to go, but we don't have a choice. Have the deepest respect for COVID or whatever what is going on, what is going around in this world, and take care of yourself. Very important point, Kusal. You said do not be afraid, and Dulan also mentioned the fear gets to you. That stress, the stress factor can really put you down, and back problems or whatever that happens to humans, and it cannot happen. I mean, it's just common. Just do not be afraid. Seek right advice, treatment, and live life. That's my attitude. Whatever happens, that it's all common to all of us. It's great having you boys once again. Great chat, and as always, and Saurabh is still writing. Kusal touched on something very important to me. I was diagnosed with severe diabetes a year ago, and apparently it had been so at least 5 years after researching. I got on a ketogenic diet. I stopped medicine, and I think, yeah, boys, it goes on. I mean, it'll go on for 3 hours if you keep going. So all good things must come to an end at some point, and you can respond to them individually. Okay, bless you too, Mervin. I hope you get better soon, and take care, and have a great week ahead of everyone. And thanks for being a part of the show. And
Thank you so much for having us, Charit, once again.
Always a
Yes.
pleasure having you guys. Take care and see you
Thanks,
soon.
Charit.
Thank you.
Bye bye.
See you, Charit. See you,
Right.
Kusal.
Bye.
See you, Dulan.
Thanks.